These are Pain Pearls, tips and hints to enhance your effectiveness as a practitioner.
I'm Dr. Richard McAmoyle, and I want to help practitioners treat chronic pain better. Let's talk some more about the non-specific effects of treatment. What I want to discuss today is body language and how we position ourselves within a room. Specifically when you're doing your initial intake exam with a patient. When you come in to sit down and have that first conversation, sitting in the room at the same eye level with the patient or below them, rather than standing above them with a commanding presence, can create that feeling of collaboration that we want. We'd prefer to have a collaborative effort with our patients rather than one of the authoritarian figure who is now dictating what they want. Using patient-centered care, we want the patient to have a larger role in their care, and we can enhance that with our body language and how we communicate. Another helpful thing is mirroring. So we can mirror the movements and the positions of a patient we can help undo some closed off positioning that they're doing. If they're sitting with their arms crossed, if we kind of start out then crossing our arms to match them and then uncross them and lean in, sort of drawing in the patient, we can sometimes have them, they'll start to mirror us and then start to do the behaviors that we're doing, which then that link between body language and cognitive affect can play a role. We can use that to our advantage. One of the other things that can be used that Lorimer Moseley introduced this idea to me was that when he's introducing information that he would like the patient to take on in a positive way, especially if it's sort of confronting an idea that they have, he adds a bit of a nod as he's telling them to try to reinforce the positive nature of the message. And from my recollection is there's some psychological research to help support that sort of mirroring body language. These are some tips that may help enhance your therapeutic alliance when dealing with patients, especially in that initial interview.
Thanks for listening. I hope you enjoyed today's Pain Pearl.